Hello, today I will be discussing Chapter 5 of Patient Education, a Practical Approach, and this is about managing medication non-adherence. Okay, so we're going to start out with the main points of the chapter. So, the first main point is medication non-adherence occurs when a patient fails to take a medication as agreed upon by them and the doctor. This could be either intentional or unintentional, as and we'll get into that later on. The second main point is non-adherence is quite common. It's a quite common thing with around 50% in most age categories, settings, and medical conditions. The third main point, non-adherence is a national crisis. It diminishes the ability to effectively treat numerous patients. Non-adherence is the most influential modifiable factor that negatively affects patient outcomes, rendering even the best medications useless. Sources of non-adherence are prescriber-related, medication-related, pharmacy-related, and patient-related, which we will get into later on this PowerPoint. And when detected, non-adherence should be considered a medical problem and treated as such through assessment, proper documentation, and an initiation of an individualized treatment plan. Okay, so now we're moving on to the introduction. As stated before, medication non-adherence occurs when a patient doesn't take a medication that's needed. This can be intentional or unintentional, and it's linked to increased rates of morbidity, mortality, and expenses. The term adherence is a synonym for compliance. So if patients are non-adherent with their medication, they are not compliant with taking their medications. Just a little bit of an easier way to think about it. Fixing medication non-adherence. To fix this issue, a variety of behavioral, social, economic, and system-related factors involving patients, prescribers, and medications must be targeted. Medication non-adherence is a national health crisis. The National Council on Patient Information and Education considers non-adherence a national crisis that spans all demographic and socioeconomic strata. It causes ineffective treatment in numerous patients. With the research conducted so far, medication non-adherence is quite common, with about 40 to 50% of it occurring in most age categories, with the highest rates in chronic therapies. It accounts for about 69% of medication-related hospital admissions. So quite a large number, 69%. The estimated cost of non-adherence is estimated to be $100 billion in our country alone, which is crazy to think about. It's quite a lot of money. So here are estimated rates with different diseases. So asthma, about 50% of medication non-adherence occurs, which definitely affects us as respiratory therapists. So this is definitely something that we need to keep in mind. And I can definitely believe it because when I'm down in the ER, I see a lot of asthma patients coming in, and usually it's because, or a factor of why they're there is because they couldn't take their medication for whatever reason. But you also have depression. About 30 to 60% of medication non-adherence occurs. For diabetes, about 40 to 50% of medication non-adherence occurs. Glaucoma, about 60%, which is really crazy to me because glaucoma is a very scary disease to have. So I'm surprised that patients that do have glaucoma aren't taking it that seriously. Same thing with epilepsy. 30 to 50% of medication non-adherence occurs, and hypertension about 40%. Detecting and diagnosing medication non-adherence. There are several methods used to detect medication non-adherence. The first one is an electric monitor device on prescription bottles, insurance claims data, which this detects non-adherence because insurance claims can track medication refills. So you would see if a patient isn't trying to refill their medication. Directly observed therapy. Lab tests, if they don't seem to be improving, which they should if they're taking their medication, that could be an indication that they are not taking their medication. And unexplained poor results of treatment. Um, Also, one of the easiest ways to assess a patient's non-adherence is to simply ask them, obviously in a non-confrontational way. Um, this includes, just asking. You could just straight up ask them, are you not taking their medication? Um, are you skipping out on it a lot? Is there any reason why you're skipping out on it, like side effects, or is it too expensive? Um, or are you just forgetting? You could just ask them what's going on. White coat adherence. What is white coat adherence? If a patient knows an appointment is coming up, their compliance will increase. Adherence is the highest 5 days before and after the appointment. That is what we call white coat adherence. All healthcare providers must be very wary of this, and to explain that sticking to the medication for all of the time that is required is important to get better. Sources of medication non-adherence. So there are 4 types of sources. We have prescriber related, and in this case, this has to do with um, the prescriber, so us. Um, and this includes poor communication, um, a lack of trust between us and the patient, lack of time and emphasis on medication adherence and education. So, if we're talking with a patient and we're not emphasizing that this medication is really important to stick to, that can cause non adherence. Misdiagnosis and detection of non adherence. So, if we don't know that non adherence is going on, then we're not going to be able to help the patient, stick to their medication. Use of multiple prescribers. So if we have a bunch of different healthcare providers, prescribing medication to this patient, that can be an issue. And lack of resources, time, and support staff to help them take their medication. Next, we have patient related. And this more so has to do with the patient themselves, right? And this could be due to a low socioeconomic status, meaning financially they struggle to get this medication. And this could be due to no insurance, low literacy. So patients may not understand the instructions for the medication, or they may not understand what the healthcare provider is trying to tell them. And that could be that could be our fault as healthcare providers. We might not be explaining in the most simple way. Uh, Language barriers. This is a big one. If patients, don't speak the English very well, and we're trying to speak to them in English, they may not, that barrier might affect them, and therefore they may not understand some things, and that can lead to non-adherence ultimately. Lack of knowledge about the medications and their disease. Um, they may not have been told, or they may not have been told very well, uh, what they have and why the medications are so important to take for their disease. So that can definitely be a reason for non-adherence. um, Also, just chaotic schedule and lifestyle can be a contributor. There's too much going on, and it just leads to them not taking on their medication because they're so focused on other things. Fear of side effects or drug dependence. This is a big one. Um, you know, Side effects are very common with a bunch of different medications, and when a patient experiences side effects, this may scare them and stop them from taking the medication. So it's very important that we explain that there can be possible side effects, and some certain side effects are very normal. Doesn't mean that they should stop taking their medication. Or if they do experience side effects that aren't normal, it's important that they tell us so we can maybe give them an alternative medication so that they don't experience that side effect, and now they're adherent to the medication still. Denial of illness, worries about social stigmas can definitely be a contributor to non-adherence. Depression, anger, stress, and anxiety, lots of mental issues can kind of be a barrier for adherence. Impaired cognition and memory issues, so they could simply be forgetting to take their medication, and this is very common with the older population, which we'll get into later on. Diminished physical capacity, like visual impairment and manual dexterity limitations. The visual impairment is also very common in the older populations. They may misread their instructions because of that. Next, we have our medication-related source. This has to do with the medication itself, and this could be due to, again, costs. They may not have the ability to pay for the medication. Medications with a delayed onset of action can definitely be a cause of non-adherence, because if they're taking a medication and they're not noticing any benefit from the medication, they're going to think it's a waste of time. They're going to stop taking it. Medications with a high incidence of side effects, again, if patients are experiencing lots of side effects, that may scare them from taking the medication. The complexity of drug regimens or administration instructions. Typically, this will be an issue with patients with chronic illnesses, because patients who have chronic illnesses just have more complex long-term medication regimens. Taking greater than or equal to 4 medications per day. The more medications a patient has to take, the harder the time they're going to have sticking to the medications, because there's just so many medications that they have to remember. Next, we have pharmacy-related sources. And this has to do with the pharmaceutical aspects, right? So, what are issues in pharmacy related sources? Poor communication between the patient and the pharmacist can definitely be a contributor. Lack of pharmacist and patient trust. So, kind of the same thing between the prescriber and the pharmacy that can kind of interlap with each other. Use of multiple pharmacies. This is a big one because they have to remember to go to a bunch of different pharmacies to get their medication. That's why it's really important that we try to send our patients to only one location so they don't have to do that. And of course, a lack of resources, time, and support staff. Okay, so what can we do to prevent and treat these sources? So first, we're going to start with prescriber-related non-adherence. And the best thing that we can do in this situation is communicate. That is the best thing that we can do. So we can discuss like potential barriers, what is stopping them from taking the medication, effective listening, listening to our patients and really understanding what's going on, and making a tailored therapy that correlates to the patient's readiness to change, and educational conversations. So communication and education. Okay, next we're going to be discussing patient-related non-adherence. So what can we do to prevent and treat this? Obviously, as we discussed before, their financial situation could be a major contributor to non-adherence. So aiding and cost assistance can be a good way to help them. Providing written instructions in their native languages, if we believe that language barriers are the main issue. Discussing misconceptions and fears about the medication. And also encouraging a positive attitude and motivating them. If we try to help our patients have a positive outlook on the medication that they're taking, this will ultimately increase adherence. They're going to want to stick to their medication, right? Okay, now we're going to discuss prevention and treatment for medication-related non-adherence. So the first thing that we can do is trying to simplify our dosing regimens. As we talked about before, some patients may have very complex regimens, so by trying to simplify those regimens, they may have an easier time taking their medications. Next is becoming more familiar with drug costs and patients' financial circumstances. This is very important for us as healthcare providers to do, because if we're kind of familiar with how much a drug costs, we may know to prescribe an alternative medication that's cheaper. And next we have discussion about side effects. Side effects can be a very big contributor to non-adherence because patients don't want to experience those side effects, so they just stop taking the medication. So if we have a conversation about it and let them know, or if they tell us that they're having these side effects that aren't very normal, we can prescribe alternative medications. Or if the side effects are very normal, we can have a conversation about it and just say, listen, these side effects are very common. It's just important to stick through it. And yeah. Next, we have pharmacy-related non-adherence. So what can we do to prevent and treat this? First thing that we can do is have open dialogue with our community-based pharmacists. And community-based pharmacists are the ones that work at pharmacies like CVS and Walgreens and stuff. Um, if we can try to encourage our patients to talk with these pharmacists, that can help clear up any misconceptions or confusions. Therefore, they'll stick to their medications. Uh, Next one suggests that all medications should be taken from the same pharmacy. As we discussed before, some patients may go to a bunch of different pharmacies to get a bunch of different medications. Um, and that's just going to cause a whole lot of issues. So if we try to get it to where they only go to one location to get those medications, that'll make it a lot easier and cause a lot less confusion. Next is carrying a list of all medications being taken to appointments and in case of emergencies. Okay, so when non-adherence is detected, it should be considered a medical problem and treated as such through documentation, assessment, and an initiation of an individualized treatment plan. Individualized treatment plans are super important to create to combat medication non-adherence. And it starts with understanding the source and educating during each visit to reinforce the importance of the medication. And certain technology and tools are used to kind of accomplish that. So technology will likely become a very useful tool for managing medication non-adherence in the future. And this includes like automated text messages, which are really useful in the pediatric population, especially with teenagers. Adherence online programs, telephone reminders, and also educational mailings, which isn't necessarily a technological strategy, but it's still a tool that's used. Medication non-adherence in special populations. First, we're going to start out with pediatrics. So about 30 to 70% of medication non-adherence is detected in the pediatric population. Treatment of non-adherence for this group involves the child, parent, and caregivers. And the caregivers include teachers, school nurses, daycare provider, and coaches. Okay, so what are some ways that we can combat medication non-adherence in the pediatric population? First, medication and disease-related education appropriate for child/teenager's age. Education for parents. Usage of reward systems, so providing ways of congratulating them for taking the medication. Text message reminders. Peer support groups. And considering chewable tablets for bad tasting liquids. Okay, so now we're going to move on to older adult populations. Chronic diseases are more common in this group. Therefore, complex, long-term treatments are often needed. The complexity of these treatments combined with an increase of combined with an increase of impaired cognition, memory, and vision causes medication non-adherence in this group. Discussing with family members, caregivers, and pharmacists are especially important. And writing instructions with a larger font and in a simpler way is also very important. So, in conclusion, medication non-adherence occurs when a patient doesn't take a medication that was agreed upon by them and their healthcare provider. Medication non-adherence is the most influential modifiable factor that negatively affects treatment outcomes. It's important that we as healthcare providers detect, prevent, and treat this issue. Okay, so again, here are the main points of the chapter. And all the images used in this PowerPoint come from the book Patient Education: A Practical Approach. And that is my presentation.